You woke up this morning feeling tired again, even after a full night of sleep. Maybe you blamed it on your age, maybe on stress. But what if that exhaustion, that bloating that won't go away, isn't just getting older? What if something inside your body has been stealing your energy for months? Doctors at one of the most respected medical academies in the world recently revealed that this could be a hidden infection that millions of people over 55 never discover. For decades, we've been told that intestinal parasites are problems of poor hygiene, problems of distant countries, problems that don't happen to responsible adults. Most people believe that if they wash their hands and eat at home, they're completely safe. That belief feels comforting, it feels true, but researchers discovered that even in developed nations, parasitic infections affect millions of adults every single year, especially those over 55. And the most dangerous part is that the symptoms look exactly like the normal signs of aging, so people never suspect what's really happening inside. A recent update from the American Academy of Family Physicians revealed something that surprised even experienced doctors working in primary care. They found that when certain digestive symptoms persist beyond 7 days, the possibility of a parasitic infection should always be investigated, not dismissed. If you want to know exactly how to recognize the real warning signs and protect your body starting today, stay with me until the end of this video. Tell me in the comments where you're watching from. I love knowing that people from so many different places are taking care of their health together. Think about the last time you felt bloated after a meal. You probably thought it was something you ate, or maybe just your digestion slowing down with age. But when that bloating becomes constant, when it doesn't matter what you eat or when you eat, that's when your body is trying to tell you something different. The truth is, as we age past 55, our natural defenses against these invaders start to weaken in ways we don't notice day to day. Your stomach produces less acid than it did 20 years ago. Your intestines move food through more slowly. Your immune system doesn't respond as quickly as before. These changes are normal parts of aging, but they also create an environment where parasites can survive more easily if they enter your body. Scientists have validated what generations of people instinctively knew. Certain foods and habits genuinely help your body defend itself from the inside out. And now, pay very close attention, because I'm going to reveal the 5 signs and solutions that can transform your digestive health after 55. Each one builds on the last, and the final point is the most important one you'll hear in this entire video. Sign number 1. Persistent bloating and bowel changes that simply don't go away. This is the symptom most people ignore because it seems so ordinary, so much like everyday digestive discomfort that comes with getting older. You might notice your pants feeling tighter by afternoon, even when you haven't eaten much, or your bowel habits change without any clear reason. Sometimes you're constipated for days, then suddenly you have diarrhea that lasts a week or longer. It feels random. It feels frustrating. But here's what the American Academy of Family Physicians wants every adult to know. When diarrhea continues beyond 7 days, it's not just a stomach bug anymore. That timeline matters because most viral and bacterial infections resolve themselves within a few days. When symptoms persist past a week, doctors are trained to investigate deeper causes. Parasitic infections can cause exactly this pattern because the organisms irritate your intestinal lining continuously, creating inflammation that won't heal on its own. The bloating happens because these parasites can interfere with how your body absorbs nutrients and processes food, creating gas and discomfort that feels constant. Many people over 55 assume this is just part of aging, or maybe irritable bowel syndrome, and they never mention it to their doctor during checkups. But your body is actually sending you a clear message that something isn't right, that the normal balance inside your intestines has been disrupted. Studies from gastroenterology departments at major medical centers show that older adults often wait months before reporting these symptoms, giving infections time to worsen. The practical solution starts with paying attention to patterns. Keep a simple note on your calendar marking days when bloating is severe or bowel habits change. If the pattern continues for more than 7 days without improvement, that's your signal to schedule an appointment with your doctor for proper testing. While you're monitoring symptoms, focus on foods that are gentle on your digestive system. Well-cooked vegetables, lean proteins, and plenty of clean water throughout the day. Avoid foods that create extra gas like beans and carbonated drinks, because they'll make it harder to tell what's causing your discomfort. Some people find that keeping meals smaller and more frequent helps reduce bloating, because it puts less stress on the digestive system at any one time. But remember, dietary changes alone won't eliminate a parasitic infection if one is present. They simply make you more comfortable while you seek proper medical evaluation. The key insight here is recognizing that persistent means something different from occasional. Everyone has digestive upset sometimes. But when that upset becomes your new normal, when it's there more days than not, your body is telling you that professional help is needed. This first sign is common, it's often overlooked, but it's also your earliest opportunity to catch a problem before it progresses to more serious complications. Sign number 2, unexplained iron deficiency anemia or constant fatigue that doesn't improve with rest. This symptom is particularly tricky for people over 55 because fatigue feels like such a normal part of aging that almost everyone experiences it sometimes. You might wake up tired, even after 8 hours of sleep. You might feel breathless climbing stairs that never bothered you before. Your doctor runs blood tests during your annual checkup and discovers your iron levels are low. Your red blood cell count has dropped. Often, the first assumption is dietary. Maybe you're not eating enough iron-rich foods. Maybe you need a supplement. Maybe it's just your age. But here's what medical researchers have documented in multiple studies. Certain intestinal parasites, specifically hookworms and whipworms, feed on blood from your intestinal wall. They attach themselves to the lining of your intestines and cause tiny amounts of bleeding every single day. So small you'd never see it, but constant enough to drain your iron reserves over time. This chronic blood loss is completely invisible. There's no dramatic symptom, no pain, just a gradual weakening that you might attribute to getting older. Cleveland Clinic guidelines specifically mention parasitic infection as a cause of iron deficiency that physicians should consider, especially when supplementation doesn't resolve the anemia. The fatigue you feel isn't just tiredness. It's your body struggling to deliver oxygen to your muscles and brain because you don't have enough healthy red blood cells. You might notice you feel cold more easily, or that small tasks leave you exhausted. These are signs your body is compensating for inadequate oxygen delivery. For people over 55, this type of anemia is particularly dangerous because it can worsen existing heart conditions and increase fall risk due to dizziness and weakness. The challenge is that iron deficiency has many possible causes: dietary insufficiency, poor absorption, bleeding from ulcers or other sources, and yes, parasitic infections. That's why proper medical testing is essential. Your doctor needs to rule out parasites as a cause, not just assume the anemia is age-related and prescribe iron pills. If you're taking iron supplements but your levels remain low despite months of treatment, that's a red flag that something else is consuming or preventing absorption of that iron. The practical step here is advocating for complete testing. Ask your doctor specifically about stool tests to check for parasites if your anemia isn't responding to standard treatment. While investigating the cause, focus on iron-rich foods that are easy for your body to absorb. Lean red meat cooked thoroughly, chicken, fish, and dark leafy greens paired with vitamin C sources. Some people find that cooking in cast iron pans adds small amounts of iron to their food, which can help, though it's not a replacement for medical treatment. The important insight is that unexplained anemia in adults over 55 should never be dismissed as just normal aging without thorough investigation of all possible causes. This second sign is evidence-backed, frequently missed by both patients and doctors, and catching it early can prevent serious complications like heart strain and dangerous falls. Sign number 3. Nighttime itching around the anal area that wakes you up or prevents you from falling asleep comfortably. This is the most specific and characteristic sign of a particular type of intestinal parasite called pinworm, and it's also the symptom people feel most embarrassed to mention. Many adults assume this kind of problem only affects children, so when they experience it themselves, they suffer in silence rather than talking to their doctor about it. But medical data from family medicine clinics shows that pinworm infections, caused by a tiny worm called Enterobius vermicularis, occur in adults of all ages, including those over 55. The itching happens at night for a very specific biological reason. Female pinworms migrate out of the intestines to the skin around the anus to lay their eggs, typically during nighttime hours. This migration and egg-laying process triggers intense itching that can be severe enough to wake you from sleep or make it impossible to fall asleep in the first place. The pattern is distinctive. The itching is worse at night. It's localized to a specific area, and it persists night after night rather than being a one-time occurrence. Cleveland Clinic medical guidelines describe a simple diagnostic test that can be done at home or in a doctor's office called the Scotch tape test or cellophane tape test. First thing in the morning, before bathing or using the bathroom, you press a piece of clear tape against the skin around the anus, then stick it to a glass slide. The tape captures any eggs that were laid during the night, and when examined under a microscope, doctors can definitively identify pinworm eggs and confirm the diagnosis. This test is more reliable than stool samples for pinworm because the eggs are deposited on the skin, not inside the intestines where stool samples would detect them. The reason this sign is so important is because it's highly specific. Many symptoms could have multiple causes, but nighttime perianal itching strongly suggests pinworm infection. If you or someone you live with experiences this symptom, it's crucial to see a doctor because pinworm spreads easily between household members through contaminated surfaces. The eggs are microscopic and can survive on bedding, towels, and bathroom surfaces for up to 3 weeks, making household transmission common. Treatment is straightforward and effective. A single dose of medication like Pyrantel Pamoate, repeated after 2 weeks, typically eliminates the infection completely. During treatment, wash all bedding, towels, and underwear in hot water, and make sure everyone in the household washes their hands thoroughly and frequently, especially before meals. Keep fingernails trimmed short because scratching can trap eggs under the nails, leading to reinfection when you touch your mouth or prepare food. Some people feel embarrassed about this symptom, but doctors see it regularly and consider it a straightforward medical issue, not something shameful or unusual. The practical message is clear. If you experience persistent nighttime itching in this area, don't ignore it or try to self-treat. See your doctor for the simple tape test and proper medication. This third sign is the most clinically specific marker of parasitic infection, and recognizing it early leads to quick, effective treatment that prevents spread to others. Solution number 4. Foods and daily habits that genuinely support your body's natural defenses against parasites. Your body already has multiple layers of protection designed to kill or expel parasites before they can establish an infection, and understanding these defenses helps you support them properly. The first line of defense is your stomach acid, which is strong enough to destroy many parasites and their eggs before they reach your intestines. As we age past 55, many people produce less stomach acid naturally, and some take medications called proton pump inhibitors for heartburn that reduce acid even further. Research published in gastroenterology journals shows that chronic use of acid-reducing medications can increase susceptibility to intestinal infections, including parasites. If you're taking these medications long-term, it's worth discussing with your doctor whether you still need them or if a lower dose might be appropriate. Never stop prescription medications on your own, but having that conversation could help restore one of your body's natural protective mechanisms. The second critical defense is proper food handling and preparation, which prevents parasites from entering your body in the first place. Cook all meat and fish to safe internal temperatures, ground meat to 160 degrees, whole cuts of beef and pork to 145 degrees, and chicken to 165 degrees. Use a food thermometer rather than guessing by appearance, because parasites and their eggs can survive in meat that looks fully cooked but hasn't reached safe internal temperature. Wash all fresh produce thoroughly under running water, even items labeled pre-washed, and use a vegetable brush for items with firm skin like apples and potatoes. Some parasites and their eggs can survive on the surface of fruits and vegetables, especially those grown in soil fertilized with animal manure. Hand hygiene is your third powerful defense. Wash your hands thoroughly with soap and water before preparing food, before eating, and after using the bathroom. This simple habit breaks the transmission cycle of many parasites, especially pinworm, which spreads primarily through hand-to-mouth contact. If you have pets, make sure they receive regular deworming treatments from your veterinarian, because some animal parasites can infect humans through contaminated surfaces or soil. When traveling, drink only bottled or boiled water in areas where water safety is uncertain, and avoid raw vegetables and fruits you can't peel yourself. Now, regarding spices like garlic and cloves that traditional medicine has used for generations, laboratory studies show these do have compounds that affect parasites in test tubes. However, and this is crucial, there are no human clinical trials proving that eating garlic or cloves eliminates established parasitic infections in the body. These foods are safe, potentially supportive, and certainly won't hurt as part of a healthy diet, but they are not proven cures and should never replace medical treatment. These practical habits work together to strengthen your body's natural defenses, reduce your risk of infection, and support overall digestive health throughout your life after 55. The most important point you'll hear in this entire video: natural approaches alone cannot eliminate a confirmed parasitic infection, and delaying proper medical treatment can cause serious harm. This is the truth that many natural health sources don't emphasize clearly enough, and it's the information that could protect your health or even save your life. When doctors confirm through stool testing that you have an intestinal parasite, the standard of care worldwide is treatment with antiparasitic medications. These medications, including albendazole, mebendazole, and Pyrantel Pamoate, are specifically designed to kill parasites and have decades of safety data supporting their use in adults of all ages. The American Academy of Family Physicians guidelines are unambiguous. Confirmed parasitic infections require medication, not dietary changes or natural remedies alone. Here's why this matters so critically for people over 55. Parasitic infections don't just cause discomfort. They cause real, measurable harm to your body over time. The chronic blood loss from hookworms can worsen existing heart disease because your heart has to work harder when you're anemic. The malnutrition from parasites interfering with nutrient absorption can weaken your bones, reduce your muscle mass, and compromise your immune system. The inflammation in your intestines can damage the delicate lining, leading to longer-term digestive problems even after the infection is treated. Every week you delay proper treatment is another week these complications progress. Another week your body loses resources it needs to stay strong and healthy. Some people believe that natural approaches are always safer than medication. But in the case of confirmed parasitic infections, the opposite is true. The medications are generally well tolerated, with mild and temporary side effects in most people, while untreated infections cause progressive, cumulative damage. There's a dangerous myth circulating that apple cider vinegar can kill parasites in your stomach, but this has no scientific basis whatsoever. Your stomach acid is already far more acidic than vinegar, and any vinegar you swallow is immediately diluted and neutralized. It has no antiparasitic effect in the human body. Another persistent myth claims that teeth grinding in adults indicates parasitic infection, but research shows adult bruxism is overwhelmingly linked to stress, sleep disorders, and airway problems, not parasites. Some pediatric studies found associations between pinworm or giardia and teeth grinding in children, but this correlation doesn't extend to adult populations in clinical evidence. You might also hear about detox protocols claimed to cleanse parasites, but there's no recognized physiological mechanism by which these protocols work, and no clinical studies supporting their effectiveness. The human body already has highly effective detoxification systems in your liver and kidneys. What it doesn't have is a natural way to eliminate established parasitic infections without medication. If you're diagnosed with a parasitic infection, the safest, most effective, and most responsible choice is to take the prescribed medication exactly as your doctor directs. You can absolutely support your treatment with healthy foods, good hygiene, and all the habits we discussed, but those are supplements to medication, never replacements for it. But before you take everything you've learned and put it into practice, there's one critical error you must avoid, and it's an error that even well-meaning, health-conscious people make every day. The most dangerous mistake is self-diagnosing based on symptoms and treating yourself with natural remedies without getting proper medical testing first. Here's why this is so risky. Almost every symptom of parasitic infection overlaps with symptoms of other conditions that are common in people over 55. Chronic fatigue and anemia could be parasites, but they could also be vitamin B12 deficiency, thyroid problems, or even early signs of more serious conditions that need immediate treatment. Here's your simple, practical action plan starting today. Focus on prevention through the habits we discussed, proper food preparation, thorough hand washing, and safe water practices. If you develop persistent digestive symptoms lasting more than 7 days, unexplained anemia that doesn't respond to iron, or nighttime itching, schedule an appointment with your doctor. Ask specifically for stool testing to rule out parasitic infection. The test is simple, non-invasive, and gives you definitive answers rather than guessing based on symptoms. If you're taking acid-reducing medications long-term, have a conversation with your doctor about whether you still need them, as they can reduce your natural defenses. Remember that feeling of exhaustion we talked about at the beginning, the bloating you blamed on aging. Now you know what to watch for and when to seek help. If this video brought you new understanding, leave your like and share it with someone you care about. You'll notice 2 videos on the screen now, and I'm sure you'll want to keep taking care of your health with us.